And welcome. My name is Kathy Shedler-Clark, and I'm the Executive Director of Steppingstone. And first of all, I'd like to thank all of you for coming out today. This is a very important issue. The month of September is Recovery Month, and we are here to celebrate. First of all, I'd like to thank the individuals who have taken the time and the effort to do all the planning for today. And it's Rosa Medeiros and Mike Hughes. We want to give them both a very big hand. I also want to give a big hand to all of the speakers also that have taken their times out of their lives to be here today, and we will be introducing them one by one to the podium to have a few words with all of you. So there's always a little story to everything, but when we all woke up this morning and we had the weather forecast is that torrential rains were coming, 100% that the rain was coming, a very special woman, Rosa Medeiros, said a few words to me, and I want to share those with you. And she said, "The struggle of addiction is one big storm, with periods of clarity, downpours, thunder, and darkness. But we can all get through this storm to the sunshine, and that is treatment and recovery." So with that note, the rain has stopped, and there is definitely sunshine to come. So my first speaker I'd like to introduce is Dr. Bharel. She is the Commissioner of the Massachusetts Department of Public Health. And as the Commissioner, she is responsible for spearheading the state's response to the opioid crisis, as well as leading the department's implementation of healthcare and cost containment legislation. Chapter 22, Reducing Health Disparities, Finding Public Solutions for Healthcare Reform, Finding Innovation Solutions Using Data and Evidence-Based Practices, and other healthcare quality improvement initiatives. Dr. Bharel comes to the Department of Public Health widely recognized for her dedication for healthcare for the underserved and vulnerable populations. She previously served as the Chief Medical Officer of the Boston Healthcare for the Homeless Program and the largest healthcare organization for homelessness individuals in the country. Dr. Bharel has served not only on the faculty of the Harvard Medical School, the Boston University Medical School, and the Harvard School of Public Health. She previously at the Massachusetts General Hospital and Boston Medical Center and has practiced general intern medicine for 20 years in the neighborhood health centers, the city hospitals, Veteran Administration, and university hospitals and nonprofit organizations. And I'm proud to welcome her today to our event.
Thanks, Kathy. Wow, that was a long introduction. I think the most important thing, although this guy was clapping, sorry. That was good. I think the most important thing I've ever done is working with individuals who are struggling with successfully, sometimes not so successfully, in and out of that storm. Where's Rosa? That was beautiful, those comments. In and out of the storm, and just trying to be a partner and hearing about the obstacles that people face and how we can, at a state level, really respond to those obstacles. So I have a couple of remarks, but thank you to Steppingstone for hosting me here today. It's a great honor to be here with all of you. Because I consider you heroes, both those of you who are here in recovery and those of you who have dedicated your lives to giving everybody, and that means everybody, an opportunity for recovery. You may have heard the statistics that Massachusetts is listed as one of the healthiest states in the nation. So as one of the healthiest states, we should all be proud of that, and we should all be able to applaud that. However, if we are to be a strong state, and if we're to be a strong society, then that means supporting all of us. And all of us includes the most vulnerable among us and those who need a helping hand at this moment. And as the Commissioner of Public Health, I can tell you that right now, we're in the middle of a public health crisis in Massachusetts related to addiction, and we all need to do our part together. The problem here in Fall River is acute. Just to give you some numbers, in 2014, our latest numbers show that there were 31 people who died of unintended opiate overdoses, and that was up from 22 in 2012. So people dying, and the numbers are only rising. In Bristol County as a whole, there were 138 unintentional opiate overdoses in that time period, more than doubling from 2009. So really a growing issue. And the only way that we're going to reverse this trend of opiate overdoses is through the tireless energy of people like you who are ready to show that recovery works. We need your support and your partnership to fight this. As a physician who has spent 2 decades on the front line of this disease, I honor this month myself by commemorating my patients. At a hospital, I cared for a former executive who almost died of cold exposure when he passed out after using opioids and was found outside the Pine Street Inn shelter. Over the next couple of years, I got to know him, and I watched his struggles and his successes with recovery. Then I most recently met a young man who had just been released from jail. I met him when responding to an emergency on the city streets outside of my clinic. After we revived him with Narcan, he pleaded for help finding a treatment bed. He was struggling to find a bed that was available for him. He didn't want to end up incarcerated again and wanted to get on the road to recovery. The narratives of these individuals are full of suffering and challenges, but also full of hope and recovery. I remember and honor these former patients as what motivates me, and I know many of you who are here today to do the work we're here to do together for the people who so desperately need it and, importantly, deserve it. Let me be clear today, as a physician and a public health professional, this is an epidemic, and this is the biggest public health crisis our state has faced in recent memory. The first way we need to fight this is by ending the stigma of addiction, and talking about it for what it really is, a medical illness. Gatherings like this are so important for us to come together and to talk together and to be open and to help each other in our struggles to overcome this medical illness. We must fight the stigma. And we must address this stigma in the way we address other illnesses and public health problems, whether it's infectious disease to chronic illnesses like diabetes and high blood pressure. This crisis isn't about someone else. These are our friends, our neighbors, our children, our parents, our siblings, and our communities. Massachusetts, under the leadership of Governor Baker, is taking a lead role in ensuring that we fight this issue on all fronts: prevention, intervention, treatment, and recovery. Earlier this year, I was privileged to serve on the governor's opiate working group that was chaired by Secretary Sutter. And this group brought together leaders from diverse backgrounds to make 56 specific recommendations on addressing the opiate epidemic, from increasing treatment options to reducing the stigma of addiction. At the Department of Public Health, we've already taken some critical first steps. The first is to understand where the problems are by using data and hotspotting so that we can understand where people are struggling to find treatment and recovery beds and make sure that there's enough access for those who need it. We're continuing to increase access to Narcan, which many of you know is a critical tool that has a proven ability to save lives. We're working on outreach and education for families and individuals suffering from substance misuse and education programs for prescribers. We continue to strive to add access to treatment beds. We need more treatment beds, we need more access, we need to make it easier for individuals to access the care that they need for this medical illness. And most importantly, we're continuing to work with programs like Steppingstone. I can't say enough about the critical work that is done here. Many of you here know this firsthand. Critical, life-saving work provided by communities in support of each other. Many of you in this room have been on the front line of this fight for a long time, way before it received the headlines that it's receiving now. To you, especially those working on the front lines every day, I offer my humble thanks and gratitude. This fight is unwinnable without your expertise and your energy, and we need you all to use your voice, to speak about your experiences, to talk about the treatment that you need, and to talk about recovery and how recovery works. As we move forward, we'll depend on your counsel and hard work. I look for your suggestions and your input about how the state could do a better job in fighting this opioid crisis together. I once again want to acknowledge and applaud those in recovery who continue to show us that there is hope and there is possibility. Thank you for having this day of celebrating recovery, and thank you for letting me be here among you. Thanks.
Thank you again, Dr. Bharel. And next up on our speaking agenda today is the City of Fall River's Mayor Sutter.
What I'm going to say is going to echo what the Commissioner just said. I want to begin by thanking you for honoring us with your presence and signifying how important a day this is for Fall River by joining us here today. The Commissioner for the entire Commonwealth of Massachusetts. I want to thank everybody who had anything to do with this event. This is so critically important to the city, and I'm about to tell you why. So all of the organizers, everybody involved in Steppingstone, and all of you who are here in attendance, and those of you in attendance who are in recovery, I want to echo what the Commissioner said right now. I applaud you. I have, as a defense attorney, which I did for about 14 years, I've had represented many people who battled addiction, went into recovery, relapsed, went into recovery, relapsed, but so I have some understanding, and all I can say is keep fighting for that every single day that you're clean and moving forward with your lives. And if you relapse, that's just a temporary setback. What the Commissioner said is so true. This is one of the biggest problems that we're facing as a state, as a region in New England. Very interesting that the Governor of Vermont, in his State of the State address, which was delivered at the beginning of 2015, at the beginning of this year, devoted almost his entire speech to this issue. That's how huge a problem he saw it being in Vermont. Governor Baker has identified this as one of the biggest problems facing the state. So the magnitude, the seriousness of this problem for the state, for New England, for the country, for Fall River is clear. I remember having a conversation recently with a local businessman, a prominent local businessman. And some of you are probably aware of this business. And we were talking about the biggest problems facing the city. And I said, if you think about it, the problem that we're having with the addiction crisis, opiate and otherwise, is right at the center of so many of our other problems. It's at the center of our unemployment problem. So we have 3,500 to 4,000 people who are unemployed, and some people who just cannot even seek, to say nothing of maintain employment, because they're battling addiction. So it's right at the heart of that problem. It's at the heart of the education problem. People talk about the fact that in Fall River we're not sending enough people on to college. When they go to college, they don't get through college. Well, it's very difficult to go on to college, to start at BCC or at UMass Dartmouth when you're battling addiction. Crime. Let's face it, I was a district attorney. I know the percentage of crimes that are prosecuted in the courthouses because of people who are addicted who have to commit crimes in order to support their habit. So just in those three issues, which are right at the center of the city's issues, unemployment, education, crime, all revolving around the addiction problem. And what's the solution? How do we make strides in a climate where we have almost double the number of overdoses in the last few years, which obviously means that we have more addicts than we ever had before? Well, I think we have to do much more with prevention. That's a truism. Everybody knows that. But not just prevention programs with adults, but prevention programs with kids. I have a middle school age daughter in the 7th grade. She needs to be hearing about this right now, and she hears it from me, but there need to be successful, effective prevention programs in our middle schools and high schools. We also, with respect to prevention, need to prevent overdoses by having more of our providers have Narcan. That's, I think, goes without saying. And we need to have, everybody says it, we need to have more treatment facilities, beds, but how do we do that? See, we run right into the funding now there. But I think that with this almost unprecedented situation here, ladies and gentlemen, where you have a governor that fully recognizes the magnitude of the problem and wants to do something dramatic about it, not just rhetoric, but to really do something about it. And you've got a commissioner who spoke from the heart the way she did, who sees the magnitude of the problem. An Attorney General, I've had many conversations with Attorney General Healy, who feels the same way. Your mayor, I'm trying to express to you how serious I see this problem. Among all the problems that I'm looking at every single day for the city, this is right at the heart of so many of them. Wonderful facilities here in Fall River, Steppingstone, of course, where we are today, but also STAR, a drug court. So we have an unprecedented opportunity to do something more about this. My own personal goal on behalf of the city, and I know it may seem to some of you to be a lofty, grandiose, maybe unrealistic goal, but I don't think it is. I think when you set a lofty goal, sometimes you reach it, but sometimes even if you get close, you've done extremely well. I'd like to cut the addicted population in the city of Fall River in half over the next 2 years. Let's work together to do that. Let's cut it in half, all of us working together over the next 2 years, and we'll be a healthier, more prosperous, and happier community. Thank you all very much.
So as we're moving along in the program, we have our next speaker, who is Linda, and she's from an organization called Learn to Cope. Linda?
Hi, my name is Linda, and I'm involved. I'm a volunteer peer facilitator for an organization called Learn to Cope. Learn to Cope is a support group for parents and family members of loved ones that are struggling with a substance use disorder. I first attended Learn to Cope in 2010. The closest one here was in Brockton, but every Monday night I drove to the meeting because I received the support, education, and knowledge I needed to know about the disease of addiction. I personally believe we can't address this epidemic unless we educate, support, and treat really the families involved. Most of us, those of us that do know what that feels like, to learn that your young loved one is struggling with this disease, it's a very lonely, dark place to be. And I'm grateful today that 5 years after my journey, I have learned to cope. We have a New Bedford chapter that I facilitate each Tuesday evening at St. Luke's Hospital. We have one in Taunton at the Parker Middle School. And I'm readily available for when we do get our chapter in Fall River. What I've learned is whether our loved ones are struggling or in recovery, recovery for the family members is sometimes a much longer journey, and we are here to provide that. So if any of you can relay this information to your parents, tell them to reach out, attend a meeting, get the support they need. We have young or people in recovery of at least 1 year or more that come in and speak to us to give us hope, and hope is something that we need to go on each day. So I have the information. There are 20 chapters statewide now. It began in 2004 by a woman named Joanne Peterson, who had no place to turn when her son was struggling. He's in long-term sobriety. She's an unbelievable advocate for the recovery community, for treatments, and as part of Learn to Cope, I'll be in Washington this weekend for the Unite to Face Addiction rally, for the Fed Up rally, and those of you that haven't seen it, it's being called The Day the Silence Ends. And so we're there, even as a family member. I do not hide behind the silence and the stigma of addiction. I speak about it, I reach out, my story is out there, and I'm always there to help any family member. So please have your loved ones reach out and get the support that they truly need. Thank you.
Thank you very much, Linda. Okay, now we are going to have a mom come up to speak to us, a testimony. She's from Fall River, and her name is Joan.
Hi, my name is Joan, and I would like to tell you a little bit about my daughter, Melanie. This is her picture. This was a year ago. She was very happy. She was engaged, and they were planning a life together. But both of them struggled with addiction. They had been out of treatment for years, and there was never any help. They both suffered from mental issues and addiction. In December, well, actually in November, Melanie became pregnant. And in December, she overdosed on heroin, cocaine, and Xanax. The police were called, Jack was taken to jail, and Melanie was put on life support. They stayed together. Melanie tried very hard to do the right things, but she just couldn't. When Jack got out of jail, they started looking for apartments, and again, trying to do the right things, but they couldn't. Jack stayed clean, but Melanie didn't. And I truly believe that between her bipolar disorder and her other mental issues, her drug addiction, and her hormones going off the charts with being pregnant, she just could not handle it. And on April 18th, she got in a fight with her boyfriend. I went and got him. She was at the Moby Dick Hotel. We called the police and we begged them to help her. And they told us that people who threaten suicide do not. At 11:45 on April 19th, I received the worst call of my life. I was called to be told that my daughter was found hanging in the shower at the Moby Dick Hotel by housekeeping. My daughter felt that there was nowhere to go, and there was no help out there for her, and she knew that she had put her son at risk. We struggled for the next 11 days, and the night before her funeral, that full day, I could not find Jack. And we just thought that he was out getting high because he just couldn't deal anymore. Only to be told at 8 o'clock at night that he was found hanging in his bedroom. I lost 3 people in 11 days because they felt there was no help out there, nor could they do it alone. And I see so many of you, and I want you to all know that there is help out there, and you have family and friends that love you. You are never alone. And yes, as parents, we may get upset and we may get mad, but it's not you, it's the disease. And we would give our own lives to save you. I wish you all the best of luck. I do have a website on Facebook called Gone Too Soon. If you ever need anything or anyone to talk to, please reach out. There are people that care. And I will continue to fight every day for more for all of you, in memory of my daughter, my son-in-law, and my grandson. I never want to see or hear of any of you like this. I go there, and I cry, and I talk to her, and every day I'm so sorry that I could not help her. So again, may God bless you all and keep you safe.
Thank you very much, Joan, for your personal experience and for sharing with us some hope. Why don't we take a brief moment of silence and say a quick prayer in terms of all the losses we've had. Is a gentleman, John F., who is going to come up and share his story of recovery. John?
How you all doing? Good afternoon. My name is John F. I'm in long-term recovery. And what that means to me is I've been sober almost 9 years. And, I'm just, real grateful to be here today. Grateful to be part of an event that recognizes what's going on today in our community. As far as my recovery story goes, I started using at a young age and ended up in places where I didn't want to be. And at the end, because I don't like to talk about where I've been, but at the end of it, I ended up in abandoned buildings, parked cars, homelessness, under bridges, crack house floors, and, places like that. In 1995, I went into my first treatment center, which was Star in Fall River. I ended up at the Steppingstone here in Fall River. Back then, John Mastery was the guy that ran it with his Boston Red Sox hat. But anyway, that didn't work for me, unfortunately, at that moment. So then for the next 11 years, I found myself in and out of treatment. And what I mean by that is out of residential, halfway houses, sober houses, treatment, trying to relocate out of state, out of town, different jobs, different relationships, so on and so forth. And then in 2006, again, I'm at Star in Fall River, and there was a gentleman that came up to me, and he said, "Peppy," that's my nickname, he says, "What are you doing here again?" Now this guy watched me over the years, bouncing in and out of inpatient, ball. He said, "Why don't you do your favor, give yourself a break and do some step work and change your ways, And so I ended up going to the Salvation Army in Brockton. And when I was at the Salvation Army in Brockton, I met a gentleman that pretty much sat me down and told me about myself. He proceeded to tell me that that alcohol and drugs ain't my problem, that I was my problem, and that there was a solution to my problem. So I proceeded to take these suggestions and follow the path of this man. And one day at a time, I found myself that my life was gradually getting better. 9 months sober, I became staff at the Salvation Army and started going back to school. I went to school, UMass Boston, and got my LADC, which now I have the LADC 2. I went on and have a couple kids in sobriety. I'm a homeowner now. I'm no longer homeless, sleeping under that bridge. What recovery has taught me is that I'm able to deal with life and life's issues and life on life terms without using. That I'm able to be a productive member of society. That I'm able to be a man, be a father, take care of my kids. My life is good, because I'm in recovery. I recently left High Point as a CSP worker, and I obtained a position with the Massachusetts Organization for Addiction Recovery, also known as MORE, as their Southeast Metro West Regional Coordinator. So with all that bigness words, what that means is this, that I go around and I educate and promote the value of recovery. And that's my purpose. So my purpose of me standing up here isn't about all that I have achieved and obtained over the years, but it's to give a message of hope, that there's a solution, that there's a way out. And no matter how that pathway is you find, you know, and that the importance of you as a person in recovery and the importance of your voice and to be able to advocate for yourself, to be heard. Because there's strength here. You know, more where I work, we do a lot of educating up in the political level with policy and trying to pass laws and all that. But down here in the community, our voices need to be heard. Because if we're not making noise down here, it doesn't get to the next level, You know, so when you hear people, you know, say like, oh, you know, I ain't got nothing to share. Yeah, you do. 30 days, 60 days, 90 days, whatever. We all have a story to tell. We all have a voice, and we need to be heard, and it needs to be shared. You know, we're realizing the importance of that. You know, that advocating for ourselves. You know, and this is stuff I'm learning at my new job. But anyway, you know, again, that you know, there's hope. You know, that there's a way out. There's a solution. Whatever works for you works. I got sober in AA, but there's many avenues to recovery. You know what I mean? Nobody that's here today needs to die of an overdose. I tell you that right now. You know, I lost many friends of overdoses, clients as well. You know, so the hope is that there's a solution. I hope you all find it, and thanks.
Thank you very much, John, for your special words. And next we have with us Brooke C., who's going to also share her story. Brooke?
I'm a person in long-term recovery. My sobriety date is July 28, 2014, which means I have not found it necessary to pick up any substance that alters my mind. I want to thank you for allowing me to share. A woman here who's not here asked me to share, Deb. It never gets any easier to speak in front of people, but if you're anything like me, I feel like I know you. I grew up in Somerset, which is right across the river. You know, it's basically Fall River. It's just separated. It's a very small, quiet town. And you know, before July 28th of 2014, I struggled with addiction for almost 6 years. In and out of rehabs, you know, all through the state of Massachusetts. My first rehab encounter, I was 19 years old, and through that, you know, my grandmother, who's just up here speaking, she's involved with Learn to Cope, and at the time, I really didn't like Learn to Cope because they educated her about myself, but it really saved my life. She was told what this disease looked like and where there were places for people like myself to go to get help. My first detox at 19 years old, I went in and, you know, that helplessness of being stripped away of all your freedom and, you know, everything's taken away from you, your clothes, you know, when you can smoke, what you can eat, when you can't eat. There's people here in recovery who can identify with that, but parents and loved ones, you know, we're on the phone with them telling them that this place stinks and I want to leave here because of X, Y, and Z, and our loved ones just want to get us out and get us safe. But really, that really hurt me in the end of just leaving a detox 5, 6 days sober and running right back at home into the streets without a solution. You know, I'm very grateful that there are detoxes around in Massachusetts for a place for someone like me to get, you know, physically off of these substances so I'm not sick anymore, so I don't have to commit crimes and rob people and steal people. But when you remove those substances away from me, I'm back on the street and I'm going to continue doing what I'm doing unless I have a solution. What I would like to see in Massachusetts is more programs after a detox. I was blessed in some of the detoxes where I was willing to go to certain places I went. but not many resources as far as, the solution that we have here. And these, I'm part of Alcoholics Anonymous, I was part of Narcotics Anonymous, I was part of Cocaine Anonymous, there's a meeting Heroin Anonymous, there's multiple meetings out there that have the solution for somebody like me, and like this gentleman up here before me spoke. That's what it took for a person like me to sit across from a woman who had the same struggles. I worked at St. Anne's Hospital for a couple of years as a certified nurse's aide, and I would see patients in and out, like myself, struggling. And I would hear nurses and doctors make comments about people like me saying, oh, there's another one, that stigma, oh, there's another addict, there's another alcoholic, there he goes again, who cares? And it bothered me because I felt as though I knew what this person was struggling with, but these doctors and nurses who grew so calloused to, the relapse and the struggles, they don't have any solution for us either. And that stigma of saying I'm an alcoholic and a drug addict, it needs to be smashed. And I love saying that I'm a person in long-term recovery, because for that it could be of any illness, and it goes along the board of diabetes, of cancer. When someone's in recovery, it's in remission and they're no longer active. So what I would really like to see in the state of Massachusetts for all those who are involved is like aftercare after a detox, instead of doing the 5-day spin and just getting released. For patients who go in as an overdose, I would like to see some form of help in that facility. Right now I'm actively working with a police officer in Mansfield. We message back and forth. I spoke at a Learn to Cope meeting last week, and we've exchanged emails, and he's emailing me these people's numbers who are struggling, and I send them, numbers for detoxes, and I send them meetings and where these meetings that they could be found. People in recovery, we have the strongest voice. We do, and like this gentleman said, if you feel like you have nothing to say, you have a lot to say. When I was 3 days sober, somebody with 6 days sober was helping me out. It doesn't matter about how long you have clean and sober, it's what you did today to stay sober is what we need to start sharing. And especially with the families and facilities that work with people like us, we need to tell them what works for us so they can relay that message. Give your number out. My number, I have an open door policy, my number is always available, to anybody, men and women. So with that being said, I do want to thank everybody who came out here to stop the stigma, to open our eyes, and to those people who don't understand, right? Because it's very frustrating when you have somebody who can't understand why they continue doing the same things they're doing, but let's try to educate them and try to explain to them this is a disease, and we ourselves, we have no more power than anybody else on this earth to keep us sober. We have to share that, that experience, strength, and hope. So you do have something to say. The counselors that you work with, explain to them what works with you and what more, treatment you need, and follow up after, and sober houses. Steppingstone, I work with a lot of women in these areas, in New Bedford and Fall River. And it's a struggle to live in places where they tell you what you can and cannot do, but it's only placed in there for a reason. For when we get back out on these streets, how are we going to live? And we need to, work with these programs and educate them more on what's working for you and not. And so with that, I just want to thank everybody for being here. And I do want to say, I'm open for anybody that needs help. My number is available for men and women. I know plenty of men in recovery who's willing to give a hand or a ride. And with that, I would say thank you for letting me share.
Thank you very much, Brooke. And to conclude the program here, we have Rosa Medeiros, who's going to come up and share a couple of words, and then you have a balloon celebration.
I don't know what else there is to say except that this disease of addiction takes all of us to fix. Mothers, brothers, sisters. You guys are the voice. You guys are the proof in the pudding. you guys are the ones who can go out like John and like Brooke and spread it and just let everybody know that not only is there a solution, there's sunshine. There's sunshine. You can have children. Your life is what you make it. And your life, you deserve the life that anyone else does. Even more so, I think, because you've struggled. You've gone through things that some people who are just going about life haven't experienced. So you have even a bigger right to that happy life than some people that are just walking around without any issues. So I wanted to let everybody know that Seven Hills is here, and anyone that would like Narcan training so that you're able to respond and help and maybe save someone's life, they're here and they can help you get trained today, and maybe even give you Narcan so that you're ready to save someone's life. I want to thank STAR as well. STAR is instrumental in our community. They're the first step to recovery. Every single one of us, when we have a friend in need or a family member, we'll say, let's call STAR, because that's the first step. So just remember, this community is enriched with a place to go to get help, to refer a friend to get help. And so, just remember STAR, Seven Hills, Steppingstone, we're all united here in this community for you guys. Our work is fulfilled only if you live healthy lives, happy lives. So we do have balloons here today for everyone. And the balloons are sort of our last little, we're going to do a tribute to anyone who's been lost to overdose. I'm sure everybody either knows someone, maybe multiple people, or if you don't, you have someone you want to send a balloon up to the heavens to keep them here. So take a balloon. We're going to send them all off in just a little bit into the sky, up to the heavens, in memory of all of those that we've lost and in memory of all of those who are here. Thank you. Yeah.
Hey, it's too early. It does.